practiced for 18 months, 19 months about, and did all my training at So those are my just a little background on me. And I do a lot of research in peripheral nerve injury. I'll talk a little bit about that, I think, tomorrow. No relevant disclosures there. So cervical radiculopathy, this is what we're talking about. It's estimated that 51% of adults will experience neck and arm pain in their lifetime. So we're talking about a very common entity, a little more controversial than the lumbar spondylolisthesis, I think. Here are some risk factors: prior lumbar radiculopathy, repetitive heavy lifting like construction workers, and then cigarette smoking. This is a really nice, rather brief but good review in the New England Journal that talks about cervical radiculopathy. I found it interesting that in contrast to lumbar radiculopathy, herniation of the nucleus pulposus is responsible for only 20 to 25% of cervical radiculopathy, and it's usually due to a decreased disc height, degenerative changes in uncovertebral joints anteriorly, epiphyseal joints posteriorly, and there you go. And you can see a nice anatomical picture here. Here's sort of that hot disc herniation, and I don't think that's the entity we're really talking about today. By the way, it is mediated by inflammatory factors, and so anti-inflammatory medications play a role. Injections can potentially play a role in helping this patient get better. Here's sort of a review. We talk about the pre- and post-fixed plexus, and I think that may throw this out a little bit, but this can be helpful in identifying exactly where the pain is. I think Dan Rue had a few very cool videos that I've watched that he talks about, different nerve roots radiating behind the ear up to the face.